hear about rising costs of prescription drugs at nearly every one of my town hall meetings. 3 years ago, I began a bipartisan effort to lower prescription drug costs. Following our Finance Committee hearings at that time, we had a markup and we had bipartisan negotiations. Senator Wyden, now chairman of the Finance Committee, and I introduced at that time the Prescription Drug Pricing Reduction Act. The bill caps yearly out-of-pocket drug costs for seniors at $3,100. It prevents drug costs growing faster than the Consumer Price Index on a yearly basis. It ends uncapped taxpayer-funded subsidies to Big Pharma. It creates more sunshine, more competition, and it even has oversight into the world of drug pricing. It brings meaningful reform while driving down costs. $72 billion in savings for seniors, that's out-of-pocket cost to them, and $95 billion savings of taxpayers' money through Medicare. An important goal that we accomplished in our bill, lowering drug costs without hurting innovation. We did this by keeping the government out of the business of setting prices and indirectly keep the government out of your medicine cabinet. Democrats have proposed the irresponsible idea of the government dictating drug prices. They would do this by getting rid of the non-interference clause in the Part D part of Medicare. It's better known as so-called drug price negotiations. But it's not negotiation, it is dictating prices. 18 years ago, I was the principal architect of the Medicare Part D program. Adding a prescription drug benefit for seniors was the right thing to do then, and it's still the right thing to do. But it needed to be done in the right way, and that right way is for the patients. In creating Part D, we enacted a very key policy, keeping the government out of the business of dictating drug prices. Governments don't negotiate, they dictate. Competition is the only thing that drives innovation, curbs costs, expands coverage, and improves outcomes. The congressional budget has consistently stated that government negotiations of drug prices would not achieve greater savings than the current market-based system, unless you restrict the formulary or dictate the price through reference pricing based upon what socialist healthcare systems pay in other countries. That's the outcome the government gets between you and your doctor's prescribing. Democrats propose so-called drug pricing negotiations. In their reckless tax and spending spree to save hundreds of billions of dollars, who was hurt by this policy? Well, of course, patients are. The Democrats would have government dictate drug pricing based upon International Reference Pricing Index. Study after study has shown so-called drug pricing negotiations will reduce the number of new drugs produced. What your doctor wants to prescribe for you might not be on that formulary. This policy would be devastating if one of those drugs was the cure for Alzheimer's or diabetes or cancer I don't believe that's what the Americans want. While Democrats attempt to advance their partisan drug pricing scheme, I hope common sense will prevail and we pass a bipartisan prescription drug bill. I have engaged with colleagues on both sides of the aisle in both in a bicameral way. I did this so common sense would prevail if we ever get to the point of Democrats realizing that the government dictating prices on an international basis of what the prices are in other countries will never get 60 votes here in the United States Senate. All of the Republican and Democrats I've contacted have expressed eagerness to find a solution to meaningful lower prescription drug costs. Holding big pharma accountable has historically been a bipartisan effort. Delivering new reforms to fight price hikes should be no different. Democrats should stop pursuing their reckless tax and spending spree that will hurt innovation and produce less cures. Instead, we should act by passing my bipartisan prescription drug bill. I think maybe there's an inkling of good news coming from the Speaker of the House, and I've had a chance to visit with her at least 3 times in the last 2 years on this very subject about my bill, when she said that she didn't think, I don't know whether she referred to the number H.R. 3, but that's the bill that has their main effort on reducing prescription drugs, when she said that she didn't think that that would have the votes to get passed. So I hope that there's some awakening to the fact that we need to do something, and that this bipartisan approach is the answer.